It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network. Features some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And speaking of helping change people's lives, we'll start with our first doctor.
He certainly has changed a lot of people's lives. It's Dr. Ken Reid, who has an amazing procedure to help relieve people's pain from migraines.
My migraine started March of 2009 from a faulty spinal tap, and right from there, my migraine never went away. I've gotten many treatments, a lot of medications, and I've seen countless doctors, and I just didn't get any relief. My mom and I went to Dr. Reid, and he felt like I was the perfect applicant for this stimulator.
I remember when Andrew came in for the permanent unit, we had to decide which side to put the battery on. It goes in the upper, outer, kind of rear gluteal region. Andrew wanted it on, I believe, the left side. Because he's a baseball player, he slides on his right side, so he wanted it on his left side. Which brings up an excellent point about the stimulators. There's no restrictions. Here's this very active young man, baseball player, sliding left and right, and no problem. He has done absolutely fine with the stimulators.
So I got my permanent stimulators implanted, and they put a little battery right at the hip, and it runs up your back. And I have 2 leads on my back, 2 leads on my temples, and 2 leads right here. And I'm able to control the frequency and the intensity of the stimulation with the remote. It's amazing what Dr. Reid has done, and I'm so appreciative of him.
He came back recently having lost a lot of weight. He lost so much weight, the little battery had gotten more superficial, and I needed to replace it a bit deeper in. But he was doing great with it. He's looking forward to going to college up at Texas Tech in a year. Like a lot of patients, he's done very, very well. I think it's safe to say that it's changed his life, certainly changed it for the better.
I don't care about having these batteries and these wires inside of me. I'm just so happy that my migraines have gone away. It's amazing what Dr. Reid has done.
Acne and folliculitis are both kind of related conditions in a way because they both involve the hair follicle. So that's where our hairs come out of our skin, and that is an area that can be colonized with bacteria, and then it can lead to an infection. In acne, the way that it develops is a little bit different in most people. It usually starts off with the tiny bits of scaling that occurs in our skin. In acne, it kind of starts plugging up the follicle. It doesn't kind of slough off as normally as it should. And whenever any orifice gets plugged up, and behind that area, you can actually start getting an infection. So there's usually an overproduction of what we call sebum, which contains oil. It gets infected with bacteria, especially what's called Propionibacterium acnes or P. acnes. And then that sets up inflammation, and then you start getting a pimple that's red, and sometimes a pustule. Sometimes they can even form cysts or nodules, and when it's really bad, they can lead to scarring. Folliculitis is related to that, but it's a little bit different. And usually what causes folliculitis is a different type of bacterium. Usually Staphylococcus is the most common cause of folliculitis, but some other bacteria can also cause it. Sometimes strep can cause it, and sometimes even some gram-negative bacteria can lead to folliculitis. And that may or may not involve the face. It often commonly involves the neck, the trunk, the arms and legs. So it's a different kind of location, but one's usually caused by one type of bacterium, usually more aggressive like staph, and the other one's caused mostly by P. acnes.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com. All of the doctors featured here on the Best Docs Network are all about changing people's lives. Like our next doctor, it's neurosurgeon Dr. Rebecca Stachniak.
Roger is a patient that came in immediately before Christmas. He was a gentleman in his 60s who was attempting to go to the bathroom and passed out on the floor. And when he awoke, he was paralyzed from his neck down.
As it first happened, I was in and out of consciousness, but I was really frightened when first of all, I couldn't move my legs or my arms.
Unfortunately, when he passed out and fell onto the hard surface of the bathroom floor like a rag doll, he didn't have any support from any of his normal muscles because he was unconscious, and allowed all of that really significant arthritis to really hurt the spinal cord.
It was the very first time that I met Dr. Stachniak. I had never had an occasion to use a neurosurgeon. I was totally impressed with how she came across as being very confident. Also, I mentioned earlier her bedside manners, the way she just held my hand and gave me that feeling that it wasn't just going to be a business deal, but it was going to be personal.
We had to reconstruct his spine from the front and the back to take away really severe degenerative stenosis that he had developed over the years that was totally unbeknownst to him. It was a very complicated surgery that was about 5.5 hours. And after surgery, we had felt that everything went perfectly, but unfortunately he could only have some flicker movements in his extremities.
And I think one of the things that I wanted to happen was I just wanted to be well fast.
And it wasn't until a couple of months after surgery that he really started to see big improvements in terms of his strength and actually starting to gain the function to be able to walk. And then as months started to progress after that, many really significant kinds of improvements started to happen fairly quickly.
And then finally you get that courage, you get that feeling in you that that you can beat this thing, that it can happen.
Kristen came in to see me. She's just a ball of energy, and she's a 21-year-old girl who just wants to be active and healthy. Unfortunately, she has the genetic makeup where she's been overweight all of her life.
This Friday I'm having my surgery, and I could not be more excited, and I'm ready. I trust Dr. Swanson, and I'm really comfortable with Dr. Swanson. I'm really excited to do this, and I can't wait. I wish it were tomorrow. I'm really excited.
This is an object in health, and that's what she's really interested in. She wants to be able to go hiking. She wants to be able to run. She wants to be able to go down a water slide. She wants to do all of these active things that normal 21-year-olds do. That's her reason for doing this. The object of being more healthy, of being able to be more active, to live a longer life. That's what it's about. It's not like she hasn't tried like every diet known to man and tried to exercise, tried all the things that you're supposed to try. So she's not had success with that. We should condemn her to continuing to be overweight for another how many years? As an adult, if you choose to be healthy, I think you should be given that choice. You should be allowed to make that choice.
After the surgery, I'm really excited to feel comfortable in my skin. After the surgery, I'm really excited to go to the mall and buy clothing from any store I choose. After the surgery, I'm really excited to ride any ride that I can because I'm not over the weight limit. After the surgery, I'm just excited to live a normal life as someone in their 20s and not feel embarrassed or ashamed or alone. Just after surgery, I'm excited just to be me, to be who I want to be.
Dana, a mother of two, was diagnosed with breast cancer and credits Dr. Patrick Allen for saving her life. To find out more about Dana's story and other life-changing stories, log on to bestdocsnetwork.com.
Chronic low back pain is a common condition. Barbara started having back pain after a fall she had at home.
I was pretty debilitated. I had very short moments of pain freedom where I could just do a few little things, and then I was flat on my back with an ice pack or a heating pad or something like that.
When I saw her in the office, she had tightness, achiness, a lot of pain in her lower back. We were unable even to rotate her spine or to tilt it one way or the other based on how much pain she was in.
Dr. Farhat suggested that we do some injections, which we did, and they were helpful, but not completely because he couldn't reach some of the places because of the scar tissue.
As a second step in her treatment, we did a second procedure called the rhizotomy or radiofrequency thermal ablation, where basically we deadened and stunned the sensation nerves in the lower back that carries all the pain signals coming from the posterior aspects of the lower back and spine and go up to your brain.
I had never heard of the rhizotomy. Kind of freaked me out at first because I thought, oh my gosh, I'll be awake during it. But my pain level was so high at this point that it was a piece of cake, really. And I didn't find a lot of help right at first, like took a couple of weeks to kick in. And when it did, it was like the most awesome relief.
I believe we made a difference in Barbara's care. We're helping her achieve pain freedom, and she's very satisfied with what we've done on her so far.
Dr. Farhat has given me pain freedom to do the things that I couldn't do before, like getting dressed, sitting through a movie, working all day. I'm pretty much pain-free 24/7, which to me is a miracle. The moment that I walked in the door to the examining room of Dr. Farhat, he treated me with respect. He gave me dignity, which I didn't have at that point.
As always, for more information on any of the doctors you've seen on today's show, please visit our website. It's bestdocsnetwork.com.
That is the place to go, and right now, Candace, the place to go is our next best doctor is Dr. Carol Norton.
We have recently introduced a new treatment to our various and sundry offerings that ties in very well with our weight loss options called I-Lipo, which is a non-invasive fat reduction technique, I guess is the best way to put it. It's not liposuction, but it does melt fat stores. The I-Lipo is non-invasive, there's no downtime, there's no discomfort, so it's an excellent technique for those patients looking to reduce fat in a very localized area without having to undergo any kind of surgical technique. The I-Lipo technique can be used in conjunction with a suction technique that directs the energy a little bit more into the epidermis itself, that then stimulates a collagen reaction. So deeper into the fat layer, it empties fat cells, but it's more superficial. The same energy actually can induce collagen response, and it causes basically a tightening effect of the skin. The best candidates for this technique are patients who have focal problem areas, such as the pooch on the abdomen, the little saddlebags that occur on the thighs. You can do it on arms. We've done it on chins. The I-Lipo, used in conjunction with a weight loss program, gets the patient to their target faster, keeps them more motivated and involved in their weight loss program because they can see the results so much faster. So the normal treatment course is 2 treatments a week over 4 weeks. You want to focus on 1 treatment zone at a time. The treatment itself takes about 20 minutes, but we do a measurement before the treatment and a measurement immediately after the treatment, and there is a noticeable difference from those measurements that we're able to take. I think that the benefits that the I-Lipo technique offers over other fat reduction techniques, it's its simplicity. It's fast, it's pain-free, no downtime, no recovery, and very definitive, almost instantaneous results. It's a quick fix. It's very natural in many respects.
Wouldn't it be great if we had a blood test that could tell you if you had cancer or you don't have cancer? Well, we don't quite have that yet, at least for most cancers, and in the future we probably will. I would say within 5 years there will be tests that we can do on your blood that will tell us if you have a tendency towards certain cancers or if you even have cancer cells in your body. There's a lot of genetic testing and a lot of research going on, so there's great things are going to happen. Now, as it is now, there are certain tests, for example, for ovarian cancer. There's a test called CA125. You don't need that test unless you have a strong family history of things like cancer of the uterus or ovary cancer in your family. However, it is a good test and can tell us if that cancer is brewing. There are certain tests that help us with pancreas cancer. But in general, the blood test that you have when you do your physical give the doctor a clue as if you are at risk for cancer. For example, you might be anemic, or your platelets, which is part of your red blood cell count, may be high. There's also other things like liver tests that may be elevated and that indicate your cancer risk is high. So get your blood test done, check it out, and hopefully in the next 5 or 10 years there'll even be better blood tests.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that we're removed so that we're sure that we've gotten all of the skin cancer. It has the highest cure rates of any technique of treating skin cancer and enables us to preserve as much normal tissue as possible while still removing all of the skin cancer. The technique is very much like the biopsy in that everything is done in the office. We just use a little local anesthetic, numb the area up, and remove the area that we can see. The way in which it differs from the biopsy is that we take the tissue that we excise and prepare it in our lab. We make our own slides, and I examine the slides under a microscope to determine if we've gotten all of the skin cancer. If we have, we stop there. If we haven't, we know precisely where any residual skin cancer is. We go back just to that area, remove a little bit more tissue, make some more slides, and keep repeating that process until we're sure we've gotten all of the cancer. If the skin cancer is very small and very superficial, the wound that results from the surgery that we do may be very similar to the wound they had after the biopsy. Very often it will heal satisfactorily on its own with good routine wound care. However, if the skin cancer has invaded more deeply or is wider than what it appears to be on initial exam, then we may recommend a repair of some sort. And they range all the way from simple side-to-side closure to a skin flap or a skin graft. And as with all cancer, early detection and treatment is the best way to cure skin cancer.
For more information on any of the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Now it's time to head to one of the best plastic surgeons in the entire Dallas-Fort Worth area. It is Dr. Bruce Hermann.
One of the things I like about plastic surgery is the variety of patients you can see. You can see more cosmetic type patients, but also you can see patients who have problems that are more functional in nature. The wound center is a great example of this. A lot of the patients that come into the wound center have wounds that have been giving them problems for months or even years.
I was 4 years old in Egypt and I got ran over by a car and I had to be rushed to a hospital. My mom said that whenever she came to see me in the hospital, all you could see was bones on my knee. And it was a big scar.
Rauda's case is one of my favorite cases I've done since I've been here. Her family's originally from Egypt, and when she was a very little girl, she was playing in her yard in front of her house and was actually struck by a police car. She was taken to the local hospital where they treated her. She had received some quite traumatic injuries to her leg around her knee, which included some burn type injuries. I saw her as a patient. I evaluated her and found that we actually could improve upon this quite dramatically.
Dr. Hermann made me feel comfortable by telling me and leading me through the process of what he was going to do to my knee. And whenever I was going to have surgery, he was planning with me and telling me what was going to happen and what he's going to do to help me.
We used a method called tissue expansion where we
We are happy to welcome to the Best Docs Network in the studio. This is Dr. Ed Singleton, podiatrist Dr. Ed Singleton, one of the best in the Dallas-Fort Worth area. Over 25 years of experience. He's your go-to guy when it deals with foot and ankle and also tarsal tunnel syndrome. Explain this as far as what people may be experiencing, the symptoms with tarsal tunnel syndrome.
First, thanks for having me today. Tarsal tunnel syndrome is a condition that's very similar to carpal tunnel syndrome in the wrist, and everybody's heard about that. It's a very similar condition that affects the nerve that goes behind the ankle and down into the foot. There's different things that cause it, but the bottom line is there's a compression on the nerve as it passes behind the ankle joint and goes down into the foot. The symptoms range anywhere from burning sensations, cold, numbness, zingers that go out the toes. People have told me it feels like fire shoots out the tips of their toes. It's sort of like hitting your funny bone.
Right.
and it affects the foot, the arch, and out to the toes.
I know a lot of people out there watching have experienced those symptoms. Now, Dr. Ed Singleton is the only one in North Texas that can treat that type of problem with a minimally invasive procedure. Explain that, doctor.
Well, I'm fortunate that I've been trained by Dr. Steve Barrett, who developed the minimal incision technique for the tarsal tunnel. Most people will approach a tarsal tunnel surgical release with an incision anywhere between 2 to 3 inches and 5 to 6 inches long, depending on how large the person is. That exposes the entire length of the nerve so that you can decompress all of the structures that squeeze on it. The approach that I use involves incision approximately 1/2 to 3/4 of an inch. That incision is placed behind the inside ankle bone, and the benefit from this is usually a much faster healing rate. Usually you're on your feet much faster, and usually you have a significant lesser amount of pain than you would with the standard open technique.
There you go. All right, Dr. Ed Singleton, providing pain freedom to your feet. Appreciate it, doctor.
Thank you so much.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
I have a 4-year-old daughter who me and her mom went through a divorce, going on 3 years next month. And I saw some behaviors on my daughter that I didn't see normal. She didn't socialize with kids. We will go to the park, we will go to McDonald's, and she will play in the playground, but then when kids will come, she will say, let's go, you know, or quit playing, just standing there besides me and then say, let's go.
She was having a really hard time in social settings, interacting with anybody besides her dad. She was very shy with even children her age. Any other adults would have a really hard time communicating with them, talking with them, playing with them. And so he was concerned that she was starting to be really withdrawn, and he didn't want that for her.
At first it was like, should I do this or should I not? But once I interviewed with Katie, you know, I kind of felt comfortable that this was the right decision.
What children do is they come in and we have a whole playroom stocked full of toys that have been researched and picked specifically for their therapeutic value. Children come in and they use toys as their words. And so based on the toys that they choose and how they interact with them, how they interact with me as the therapist, really gives me a clue into what they're struggling with at home, at school, and gives me a great idea about how to help them through that.
I had doubts of bringing my daughter, thinking that she was too young. You know, I even asked her a couple of times, are you sure that her age, is she okay? She said, you know what, it's the sooner the better. You'll be surprised how many parents wait until kids are 11, 12, you know, and it's tough on them.
In the first several sessions, she wanted dad right next to her and really close with her. As we've moved on, her self-confidence and her ego strength really has just been incredible. She's gained a lot of strength through this process.
You know, it's a great feeling. Seeing her progress and seeing that she has built confidence in her, it feels really, really good. It's a great satisfaction.
That will do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives.
And for more information on any of those doctors, any of the doctors you've seen on today's show, just visit our website at bestdocsnetwork.com.
And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. And Candace, also the Best Docs Network magazine.
That's right.
Check it out. Newsstands near you. So long, everyone. We will see you next week.